Hi, I'm Caitlin Linhart. I'm the Vice President of Human Resources at Burrell Behavioral Health. I lead a team of HR professionals that help support 1,800 employees across 17 counties in Missouri and 8 in Northwest Arkansas. Burrell offers outpatient therapy and outpatient psychiatry services, but also a wide variety of substance use disorder treatments for both youth and adults. We also offer some specialized services for our youth populations such as autism and ADHD. And then a lot of our services are actually integrated in the community, in schools, in medical clinics, doctors' offices, and through partnerships with judicial and social services. Everything has changed here recently in the last year, and mental health has become the forefront of that conversation. So while COVID is negative, the focus on behavioral health is absolutely a positive. People are now beginning to realize that you don't necessarily have to have a chronic mental health issue in order to seek care. We are turning the conversation that it is great for wellness, for relationships, just even if you're going through a hard time. We all need support, and that's totally okay. So something that we launched was the Be Well community. This is a daily live stream that's led by licensed psychologist Dr. Shelley Farnan, where she leads us through some different things for mindfulness, meditation. She shares self-care tips, just to help us focus on wellness as we're going through this tough time in our world. Another thing that we've focused on this past year is really access to care. So telephonic and telehealth services have increased, and now our clients can access care anytime that they need it, wherever they are. Burrell offers more than just the traditional, you can go access a therapist or a psychiatrist if you need one, but now we're really focused on prevention. So focusing on those self-care tips and tricks that we get through the Be Well community, but also that is becoming more focused on business and what our employees are going through. They're all navigating something completely unique, and this will help them through that. Everything has changed this year, and every single person has been impacted at least in some way. The change fatigue is absolutely real, and the focus on mental health is becoming more important now than ever as we are all trying to navigate difficult decisions for us, for our workforce, for our coworkers, and for our families. The pandemic has really changed how we work. A lot of industries have transitioned to a remote workforce that typically wouldn't have in the past. So it is really critical to determine how do we engage our employees while we're completely physically distant. And that is going to be important to learn now, because after the pandemic, this might be something that sticks around. So creating virtual opportunities for employees to connect has really helped Burrell employees stay connected. So having those different forums where they can have honest conversations, share feelings, engage in mindfulness and mental health wellness exercises together has been crucial. Something else that is important right now is employee engagement needs to be a focus this year. So our employees will always remember how their employer navigated through COVID-19. And this is something that we need to continue focusing on in the future as well. Employees want to feel safe, supported, connected, and we can make that happen even in a remote workforce. And the biggest shift over the last year is determining how do we take care of our employees in a very unique way, where their whole world is being flipped upside down and they're having to figure out, how do I maintain my full-time job, take care of my children while they're in school remotely, make tough decisions for families about whether they go out in public or not. There's a lot of unique things that have been different, and as an HR professional, we've had to pivot like never before. Our employee engagement strategies are different. Our wellness and benefit strategies have changed over this last year to be able to accommodate some of those things that we did not even think would happen back in 2018 or early 2019. So it's all been new. At Burrell, we have focused on transparency through the pandemic. We have truly asked our employees, what do you need? What support do you need? What would you like to see? And then when our employees answered us, we had to act on it. So that would be what I would recommend as a nice entry point, is create that space for a virtual open conversation, and then act on the feedback. Create an action plan that will help get some of those wins that your team is looking for. By having Burl here, you have access to care 24/7. We're here to support our employers in the community as they are embarking on their mental health wellness journey, whether it's through self-care with the BWAL community or through an EAP service. Burl's here to help.